Hi ladies, it's Shanette with Pain Free Period. Uterine fibroids is one of the most common occurrences amongst women. However, when compared to other races, statistics show that Black women are 2 to 3 times more likely to have uterine fibroids and develop them at a younger age. What exactly is uterine fibroids and what are the symptoms? Well, uterine fibroids are muscular benign tumors that grow in the wall of the uterus. They can either grow as a single tumor or there can be many of them in the uterus. They can become as big as a watermelon. Some of the symptoms of uterine fibroids are heavy bleeding and painful cycles, feelings of fullness in the pelvic area, enlargement of the lower abdomen, frequent urination, lower back pain, and reproductive problems. Around 50 to 60% of women experience no symptoms, making it even more difficult to receive a diagnosis and the proper medical treatment. As common as fibroids are, there still hasn't been enough research about its direct and disproportionate effect on women of color. Statistics show that 9 out of 10 Black women will have fibroids before the age of 50, versus 6 out of 10 white women having fibroids. While researchers and doctors have not been able to form a solid reason for the higher rate of fibroids affecting Black women, data suggests that low levels of vitamin D, which Black women are more susceptible to, increase the likelihood of the development of uterine fibroids. Other factors such as higher ratios of obesity can also play a role in what researchers have assumed to be the reason for the higher rates of fibroids. Unfortunately, as most women continue to deal with the pain of fibroids, they continue to brush it off, thinking it's normal because other women in their family have experienced the same pain and symptoms associated with the fibroids. According to the study, the burden of uterine fibroids for African American women, Black women tend to wait longer to seek treatment. About 42% of Black women wait 4 or more years before pursuing treatments. For this reason, the hospitalization rate for Black women is 3 times higher. One of the most common procedures for uterine fibroids is a hysterectomy. But in some cases, women opt for a myomectomy, which means the uterus remains preserved while the fibroids are surgically removed. Fibroids account for 1/3 of all hysterectomies in the United States, with the hysterectomy rates among Black women being more than double that of any other ethnic group. As research continues, doctors are still trying to figure out why the case for uterine fibroids amongst Black women is at such a disproportionate rate than any other ethnic group. While it is very common, that doesn't make it any easier to deal with. We hope that all women will continue to advocate for themselves and others.